In this video, we will look at soft tissue techniques, mainly for the muscle called the supraspinatus, which will sit in the supraspinous fossa here, and then it will attach to the greater tubercle, and it will initiate abduction, and is one of the muscles that is responsible for rotator cuff tendinopathy and the majority of shoulder pain. The second muscle we will look at is the infraspinatus, and that is located in this area called the infraspinous fossa, and it will attach to the posterior inferior part of the greater tubercle, and it mainly externally rotates the glenohumeral joint and horizontally extends. The teres minor we'll also cover, but briefly, and it will attach from this lower axillary border here, and it will attach just slightly inferior to the attachment of the infraspinatus, and it works in conjunction with the infraspinatus, i.e. to externally rotate the humerus. Now, what we're going to use is a wax from Songbird, and it's a fascial wax, and we hardly use any of this. What we do, we just rub 1 or 2 fingers across, and we just apply that along the spine of the scapula here, and then just above it into the supraspinous fossa. So we don't need much, just enough just to cause like a sheen to the skin. And also we're going to cover the area of the infraspinous fossa, and maybe just a little bit more of it, because we can always add some. What we don't want is for it to be too shiny, because you'll keep slipping off it. I'm going to show a variety of techniques, and it's difficult to say exactly what these techniques are. So I tend to put them under my own umbrella, and I normally call them the Bodymaster Method fascial techniques, rather than using the standard sort of names of other authors. So what we're going to do first of all, find the spine of the scapula. Now, already the trapezius is active here. I'm controlling the arm, and what I'm going to get my patient to do in a second is they're going to slowly lower the arm. Now, if they slowly lower the arm, it means that the supraspinatus is working eccentrically to lengthen the movement, and which is fine. But the thing is, it's still contracted. So we can start off doing that technique. I tend to use one finger over the other, like this, so I reinforce it. I don't tend to use thumbs ever, so I try to find the fossa here. My finger and thumb in the space, and I'm going to get my patient to slowly lower their arm down. And if I feel she's going too quick, I can stop, I can come back up, and then we can use a breath in, breathe in. And as they breathe out, they can lower the arm down. So I'm gliding through the supraspinous fossa here. Okay, find the spine of the scapula, there it is. So I'm going to change my angle a little bit. So I'm going to come down this way. So I'm going to come across the tissue here. The way I like to do this one in reality, not so much on females, but a man where they've got like a very large upper trapezius, it's very difficult to work into the tissue. So what I tend to say to my patient is, if they slowly push your arm down against me, gently, now the tissue, look, it just relaxes here. So the idea is that if they adduct, it tells the abductor to relax. So it's almost like an inhibition technique. So the thing is take a breath in, get the patient to slowly push their arm down. So now it's inhibited, and now I can glide through the tissue as my patient is pushing the arm down. And that technique works very well because I can glide as she's adducting, and that works really well. If I said to my patient, hold their arm, just hold, she has a state of isometric contraction here. If you hold for 10 seconds, it's called a post-isometric relaxation. Relax now. And now we have a window of opportunity of 25 seconds, but now we can use an inhibition technique, almost like a reciprocal inhibition of MET. Push your arm down again. So she's pushing as I'm gliding down through the supraspinatus muscle in that spinous fossa here. And that works really well. To continue with the technique on the infraspinatus, if I get my patient to reach forward on their own, okay, so if I get them, look at my fingers, 3 fingers, I can reinforce if I want to. If I get my patient just to glide forward, so this is active motion by the patient. Okay, one would call this maybe like an STR, like a soft tissue release technique. Okay, as I'm gliding through, so my patient is doing the movement, but you can see already that I like to assist and control. So if I do the movement, it would be now a passive release technique, okay, rather than the patient actively bringing their arm across. All right, so I'm drifting into teres minor a little bit. It's normally a little tender there. There's a little point just there. So I can change angles. I can ask my patient to slowly reach across their body that way. And that works. That's a little quick, that one. Or I can ask them to slowly lower the arm down. Hold your arm and off you go. So now she's working actively as I'm, slowly, as I'm gliding through. I like to do it passive because I control the speed. The other technique I use, and I prefer, is my almost like knuckles here. Slowly reach, please, so I can glide. What I like about the knuckles, I try to keep my arm straight and I can change angles. I can eye control and I can rotate my hand and I can glide down through. And if it's a tender point, I can wait, almost like a trigger point treatment. And I can glide through like this. If I said to my patient, push their arm back, push against me, you can see the posterior deltoid here. It's still horizontally extending, so the infra and the teres are still working in that position. After 10 seconds, relax. Now we have this window again of 25 seconds. And if I said to my patient, slowly pull your arm against me, so now she's push in, now the tissues soften. And as she's push in, it's now inhibition. So now I can glide as my patient is still bringing the arm across the body. So all these are under the umbrella of a Bodymaster release technique. But even though they are almost individual techniques in themselves. Again, I would say less is best in terms of treatment. I never suggest how many, as in 3, 5, 7, etc. Just do it until you feel there's a change to the tissue. Okay, but please don't over-treat, because you might find that you irritate and you actually bruise the tissue. So be careful when applying these techniques. So there we have treatment of the supraspinatus, infraspinatus, and a little bit on the teres minor.